Hello everybody and a warm welcome to our webinar. We are Bay Active Physio and today we're hoping to discuss and explore ante and postnatal physiotherapy care and hopefully shed some more light on what we can offer as physios for women who are transitioning through this very exciting period of their lives. We will also touch shortly as well. I'll just start to share the screen now with you. We also will touch on the exercise-based services that we offer here at Bay Active, inclusive of Clinical-Pilates, which we host wonderful classes in our studio. My name is Michelle Bowman and I represent one of the physios within the team with a special interest in women's health. The other physio who has a special interest is Narveen Kaur, and she contributed to this presentation as well. So thank you, Narveen. Between us, we have around a couple of decades worth of experience, and both Narveen and I have specialized in musculoskeletal physiotherapy. And then further on from that, we have delved a little deeper into the women's health side of the musculoskeletal domain. I myself have worked in the Women's Health Service within the Scottish National Health Service back home. I'm also a clinical Pilates instructor, as is Narveen, and both of us have gone through quite robust postgraduate training, particularly with advanced manual therapy associates, to really hone our skills in both triage, assessment, diagnosing, and of course treating complex pelvic girdle pain or pelvic girdle dysfunction with women who are in those childbearing years. Both of us are also skilled in musculoskeletal dry needling, and Narveen is skilled as well in the integrative acupuncture techniques. So we're going to be working through a number of topics today. We will chat a little bit about what physios do in this population, the musculoskeletal implications of pregnancy, so what happens throughout the system, therapeutic exercise, so as of course one of our gold standard and most valuable training or treatment assets is exercise. We'll also talk a little bit about what we can offer as physios, so what exactly is in our toolbox and what your clients can expect when they come for their physiotherapy assessment. We'll just take you through how to refer and how we triage. And finally, we will have a little show of our facilities, which are state-of-the-art and brand new. So first and foremost, why physio? So as physiotherapists, most of you I'm sure would agree that we are highly trained in the management of any sort of musculoskeletal pain or dysfunction. And if we look at women in the childbearing years and we just look at low back pain and pelvic girdle pain, so PGP, as on the slide, there's a really high incidence. So in terms of low back pain, which I'm sorry, the slide doesn't quite show that. So that's your far left circle. So that should read that in most studies, around half of women, so more than 50% usually, report some sort of back pain during their pregnancy. So that's massive. Furthermore, if we just go across to the second pale grey circle where we talk about pelvic girdle pain or PGP, we're looking at between 16 and 25% incidence depending on what research you're looking at. And then if we come forward to the dark grey circle, the stats increase the more the woman progresses through their gestation. So 34 weeks pregnant, we're looking at there can be as much as 7 out of 10 women complaining of either low back pain or some sort of pelvic girdle pain or a mix of the two. The big problem really is that if we look at women down the track, so in this particular study, 1 year postpartum, 8 to 22% of women are still experiencing symptoms. So that could be nearly 1 in 4 women still having issues with their back, pelvis, or hip pain. Furthermore, as well as being able to treat musculoskeletal pain and triage that, we're also really well placed to be leading the way in terms of supporting women reach their exercise targets in the childbearing years. but even more specifically, really rehabilitate women after giving birth. It is ultimately major abdominal surgery if a woman has a cesarean section. And 1 in 4 women report some sort of pelvic floor dysfunction after giving birth. And that's just a general statistic. So that's not even looking at instrumental deliveries. So it's an absolutely massive change in the body. So it makes sense that we actually fully rehabilitate these women and don't just let them listen to their bodies and get on with it. We really advocate that physiotherapists are involved, especially in that 6 to 12 week mark when women are starting to get moving again. Ultimately, physiotherapy is supervised and therefore safe. And furthermore to that, if we just go back, the big exciting part for us really to remind you all is that your clients can get private health fund rebates. So they can come to see us for one-to-one exercise or indeed go do a class, and insurance is going to support that. In terms of what triggered us with doing this webinar, one of our big concerns was obviously the COVID lockdowns. We are concerned that women have had limited access to both antenatal education, whether that be through formal means, through the health system, or just through community groups. These will not be obviously going ahead or haven't been going ahead in the last few months. So we're really concerned that women just haven't had the same access to education, and they certainly haven't had the same access to supervised exercise that is tailored for women who are pregnant or postpartum. So we think there may be a big lack here. Our role, so if we look at the governing body who is in charge of physios who work within the women's health and pelvic health domain, they really describe our role as physios as the prevention, assessment, treatment of musculoskeletal or orthopedic dysfunction relating to pregnancy, childbirth, and infant care. If we just look at the musculoskeletal implications of pregnancy, it's huge. So in terms of the obvious thing, the uterus is going to grow massively in size, and the sheer increase in weight and front loading means that the pelvis is going to tilt forward. Okay, so we call this an anterior tilt forward. What is this? Why does this matter? Well, ultimately, if you think about the pelvic girdle tilting forward, and we think about the pubic joint, so the symphysis pubis, what will happen is it will come from an orientation near the front of the body to tucking all the way under the body. And this can be a real problem in terms of groin, hip, pain. And then if we think about what's happening at the back, the lumbar lordosis, so the arch in the woman's spine, will also ultimately increase. And that will naturally put more stretch on those muscles supporting the spine at the back. What a lot of research has shown is that with that anterior tilt, an increase in lumbar lordosis, you get a decrease in the segmental stability. So the little muscles that are basically train tracking between each lumbar segment, they become a little bit more stretched and a little bit more inhibited as a result. The glutes are mentioned as well because, again, research paper after research paper does show that the length tension ratio, so how much stretch is on those muscles, means that they're in a really non-optimal position to appropriately contract and support the hip joints. So it's quite common, as you must know with most of your clients, that women will get this outside of hip pain, this lateral hip pain. We really ultimately see compensations from the pelvis happening up above it and down below it. So the whole kinetic change is influenced. So if we just start with going above the pelvis, we will often get floating ribs. So this is just where the uterus has massively increased in size, the abdominal cavity is having to accommodate, the diaphragm moves up, the stomach comes out the way, the organs start to just gently become a little bit more squished. So the ribs just start to float out the way, just to give the women a little bit more room within the abdominal cavity. The ribs float up, you'll tend to get the head coming forward and the upper back rounding a little bit. So many women can end up with neck pain, headaches, you name it. If we go below the pelvis, then we're thinking about again, those weak glutes that we mentioned, the hypertonicity in the lower back muscles. And ultimately what may happen is that we get those legs becoming a little bit more drawing more inward, the inner thighs becoming quite tight and sore. And the increase in weight and during a typical pregnancy can actually be between 16 and 22 kilograms. So a massive increase in weight gain means that the feet often flatten a little bit more. So that inner arch, the subtalar arch, ends up flattening a touch. And there has been research showing a correlation between pregnancy and an increased incidence of plantar fascial pain. If we think about exercise, so I mentioned that really is the gold standard when it comes to evidence-based practice and physiotherapy. So there's a number of things that women will benefit from exercising. So if we just look at the far left column to start with, so strength, really obvious. So if somebody's coming to physiotherapy, they're naturally going to be given some strengthening exercises. We know that in pregnancy, the ligaments become lax with the relaxin hormone peaking around 11 weeks. So it's not long, it's really not long before women are starting to really have to rely a lot more on the dynamic muscle system to provide the support that the ligaments just won't. So 11 weeks, very early. So in exercise prescription, we take into consideration the pelvic floor, the glutes, the lower back intrinsic muscles, so multifidus and the deep core, the transabdominals, the obliques. We think about the pelvic girdle support as a circumferential job. So we're really thinking about strengthening the legs, strengthening as much as we can the deep, deep tummy, and strengthening the hips and the glutes. In terms of mobility, as I mentioned, that those ribs can really flare and it can really create issues around the thoracic spine and the thoracic rib cage. So that's a key area of focus that we often think about. Furthermore, the hips. So not just to feel good during pregnancy and to get all the really great benefits from exercising in pregnancy, but if we think just about labor, if women's hips become quite tight, the inner thighs becoming quite short and high tone, this isn't going to really bode well for them getting into the adequate positions to make labor an enjoyable and seamless and efficient experience for them. Ultimately, with everything changing, like we discussed, we want to keep women aware of where they are in space. So postural, being aware about their postural positions is again a key focus. And the efficiency of movement. So we've already mentioned that a number of those key stabilizers will end up a little bit shut off, or we use the term inhibited. So again, our prescription will very much be tailoring around making sure that women are moving efficiently, transferring their weight efficiently through the pelvis to minimize stress, load, or pain. And the other juicy benefits for exercise are endless. So apart from the obvious, reducing stress, reducing low mood and anxiety, it helps people sleep. It helps reduce the chance of preeclampsia. It helps lymphatic drainage and prohibiting peripheral collection of the increase in interstitial fluids. And really exciting research has picked up on the fact that exercising during pregnancy, just at about 50% of their preconception levels, can actually decrease a woman's chance of getting gestational diabetes by 30%. So if that isn't enough to really advocate exercise, I'm not sure what will be. It's really exciting, this space. And again, furthermore, exercising pregnancy has been shown time and time again. I've actually listed a number of those research articles there for you, just to show you the length and breadth of where we're getting our statements from. That exercising in pregnancy can reduce the risk of cesarean section and instrumental deliveries. That's really exciting. When we think about fetal benefits from exercise in pregnancy, again, it's pretty exciting stuff. So stress in newborns is reduced in women who exercise. And again, that's from the same research paper that just expected women to be exercising at half of the volume that they were preconception. So we're not talking a lot, we're not talking every day. And then furthermore, many women are a little bit anxious, and also health professionals can be anxious about, how much exercise is good and what intensity is also safe for women when they're pregnant. And listen, again, the Royal College of Obstetrics and Gynecology in 2006 reaffirmed the statement that exercise does not increase adverse neonatal outcomes. And further to that, more and more research is really advocating that it shouldn't be low intensity. Exercise should be moderate intensity. They can just about chat to a friend while they walk, while they exercise, while they participate in a physio-led Pilates class or whatever it may be. And finally, fetal cardiac autonomic control. So basically, in layman's for everyone, it may be that exercising during pregnancy actually has a long-term influence in what bub will grow up to have in terms of their cardiovascular health. So if mum is healthy while she conceives and then healthy while she's pregnant, that baby is going to benefit from that potentially lifelong. So really, really important. If we move into thinking about that postnatal period, what's worth to note is that even postnatally, things just aren't quite the same. It can take women a long time for their systems and their musculoskeletal health to really come back to what it was pre-conception. So if we think just about the ligamentous laxity that everyone's very familiar with, so as I said, that can peak, that hormone that makes us really loose and lax, peaks at 11 weeks. And it can take 5 to 6 months to really go back to normal after delivery. So that woman potentially spent over a year super lax and struggling with stability. Furthermore, the cardiovascular system and the kidneys, again, they don't go back to being normal as such until about a year postnatally. And if we look at that little list of benefits of exercising in the postpartum period, there's the obvious things there. But again, if you look just down to bullet point number 5, the bone density, that's been shown to be 18 months in some women. So 18 months it can take postpartum for your bone density to really go back up to a normal level. So we do see a higher incidence of stress reaction injuries and stress fractures in women who have just given birth. If we think about the toolbox when it comes to physiotherapy, we've got right from the beginning triage and diagnostic skills. So we're able to take a woman into our care and give them answers. Allow them to understand by education and advice how to manage their pain. We can offer manual therapies. So what that really means is any sort of hands-on therapy to guide either soft tissue, so muscle, ligament, nerve to let go, release, open, or articular surfaces or joint spaces, areas where bone and bone meet and joints are interacting to open, mobilize, move more. And as mentioned before, both Marvin and I and a lot of the staff here at Bay Active are also trained in musculoskeletal dry needling. So that's a postgraduate qualification that many of our clients really, really enjoy. Exercise prescription, I'm sure you've got the message of exercise. It's massive and we love doing it here at Bay Active in all sorts of settings. And then further to that, we really help women goal set. So we're making things specific, we're tailoring it to what their needs are and tailoring it to where they want to go. So it might be quite different for a woman who lifts heavy weights, say, versus a woman who just wants to get back walking with a pram. Preparation for birth. So I've already mentioned positions, really important. We can also teach women breathing techniques and relaxation techniques for labor. And we do also organise the lease of TENS machines for pain management during labour. And finally, classes. Again, I've mentioned this before and we'll talk a little bit more about it in future slides. So if I just hone in on 3 of those areas in particular, so the manual therapies, it can sometimes be a little bit uncertain about exactly what that really means within a physio context. So as I mentioned, we first of all start with a specialised assessment. So any of the physios that your clients come and see, they'll have gone through specific postgraduate training on how to assess the pelvic girdle, quite particularly to see what that laxity has led to. Is something sitting high? Is something sitting forward? We can really particularly diagnose dysfunction around this area. And that will then nicely lead on to us selecting the correct technique to try and guide the pelvis back into a more balanced position. We use the dry needling mainly for deeper tissues that are really hard to get to with our hands. So for example, one really particular muscle of notoriety within both healthcare settings and with many of our clients is the piriformis muscle. Really, really deep, small muscle inside the hip, and can cause a lot of pain and trouble for women especially. So that may be an example of a soft tissue that we might needle to try and release the tension and drop the tone. Exercise prescription. So naturally it's rehabilitative. It isn't general, it's specific to what women maybe come in with, their problem, where the dysfunction is, what's tight, what's weak. It's naturally going to be safe. We're highly trained in exercise prescription in this group. Pelvic floor advice, most of the research out there is that it has to be specific. So again, we can really help women with activating and retraining their pelvic floor. And what's quite exciting is I will be doing my pelvic floor and pelvic health training in the new year. So we may be able to be offering internal assessments of the pelvic floor in just a couple of months. And then of course, generally with exercise, just making sure that women are meeting the general recommended guidelines. And as I mentioned, they're really important for both mum and bub. Just to add on to everything we've just mentioned, the belt supports. So pelvic girdle pain / symphysis pubis dysfunction is what that first bullet point should read. So belts have been shown time and time again to give women a lot more time on their feet. So it just lets them work, it lets them participate in social stuff, it lets them exercise. So they can be really useful, and we have a number of different belts that we would prescribe women depending on what they're going through. We can also fit and provide splinting for things like de Quervain, so mum stump, carpal tunnel syndrome, which is really just linked into the fact that women have a higher level of interstitial fluid when they're pregnant. So we have this increase in peripheral edema or effusion in the peripheries, and it can just create some chemical and partly compression and compressive stress onto the very sensitive nerves in that carpal tunnel. And then we mentioned the feet flattening with that increase in kilograms during pregnancy. So again, orthotics is something that we do prescribe women just off the shelf initially, and then we'd refer on to our colleagues in podiatry. We thought that that was appropriate. So in terms of if you have somebody you think may benefit from physiotherapy, whether they're pregnant or they're postpartum, the easiest way really is for that client to contact us directly. So somebody can completely self-refer. You do not need to have a referral. When they get to us, they'll be placed with one of the physios that has one of us, so Narvi, myself, one of the other girls who is interested in this area. And what we'll tend to do is use the Paramedic X triage screen just to make sure that they're absolutely appropriate for physiotherapy. Further to that, as I've already gone through, we're going to provide them with a really holistic, focused and tailored assessment. And then that will naturally just carry on through to working with that client to make sure their treatment plan is actually specific to their needs. We may find that woman may have a couple of sessions of physiotherapy one-on-one with us to get their pain under control, get everything balanced again. We may be prescribing aids, whether that be belts. And then we may go from there into a studio setting that may be one-on-one doing physio-led rehabilitative Pilates, and then potentially later going into one of our classes. So our classes here at Bay Active, they're all led by physios. So that's a really important thing, that everything is going to be really safe and well guided. They're deliberately kept to small numbers. So it's a semi-private environment, meaning that we have our eyes on these women at all times, making sure that they're moving well and efficiently. It's tailored. So even though we're in a class setting, women are very much tailored to their needs. So some women may not be able to be on their backs for certain things at certain points in their pregnancy. They may have pain in particular areas. They may be doing really well. It's semi-private. We will have no more than 4 people at a time. So we're often just prescribing and promoting different exercises for different women within the setting. It's Pilates inspired generally, but we tend to use a mixture of things. So we can be using bands, small equipment, steps, small weights, it just depends. Our facilities, I've already mentioned, we had a massive upgrade last year. So this is just this middle image here is the outside of the studio and a couple of private treatment rooms. We have a wonderful massage therapist, Linda, who works primarily in one of those private rooms off to the right. The second room to the right has got our reformer Cadillac split pedal chair, which is specialist Pilates equipment, so we can do one-on-ones in there. And then just around the back here, we have the studio. So we have a lovely, two lovely pictures there of our studio space, which has got enough room usually for around 8 in a class. As I said, some of those Pilates postnatal classes may be a little bit smaller to 4. And it's state of the art. It's absolutely gorgeous. It's a great space for women to come and feel supported during their pregnancy. And it's really accessible for anyone living or moving around the Double Bay area. So listen, thank you so much for your time today. We really hope that that was insightful, that tale showcase what we can offer your clients going through this really exciting phase in life. This is myself on the left here, and this is Narvi on the right. We'd love to meet your clients. As I said, any further questions, please feel free to call us directly or email through to admin. Again, thanks for your time and have a lovely day.